Well, welcome. Today we're starting the immune system. Just going to do an overview of white blood cells. We're going to talk about the white blood cells. I'm going to divide them up into first responders, the late responders, and the dendritic cells. We're going to learn about an antibody versus an antigen, how to remember that, and the infections of those late responders, which include the examples of mononucleosis and HIV. The bone marrow is the origin of all the red blood cells, of all blood cells, not just red blood cells, of white blood cells and also platelets. And they come from these single cells, stem cells. So a further breakdown, white blood cells can be divided into these first responders that are shown in this upper image with the red circle. I'm just depicting that that's a blood vessel, that those are in your bloodstream predominantly. And then those second responders predominantly are hanging out in this green circle, which is representing a lymph node. So first responders, I equate them to the grenade gang. They include the neutrophils, basophils, monocytes, and eosinophils. And they do just a massive attack. So everything gets killed when they're releasing all these toxic granules. So they're destroying local tissue as well as pathogens. Now, these second responders, the ones from the lymph nodes, are going to be initiated to be more of a targeted approach. So they will produce antibodies, and the T cells will turn into killer T cells. And after they've been exposed to the antigen, they're going to be a very targeted approach and very direct and kill the pathogen rather than the whole tissue. So within the lymph nodes, these cells are going to produce antibodies, the B cell, and the killer T cell comes from an activated T cell. So in order to do this, these lymphocytes, B and T lymphocytes, have to be primed. So they get activated after they've been exposed to an antigen, and then they're able to make this targeted attack upon a person's second exposure to that antigen. First question, surface proteins. Do bacteria, for example, this is my example of an antigen, of a pathogen, just gave you the answer. Do bacteria carry antigens or antibodies on their surfaces? And the answer I told you were antigens. They carry antigens. So antigens are antibody generators. So antigens are antibody generators. They're carried on the surface, bacteria, viruses. And when we get further in these presentations, we'll talk about how antigens can be on the surface of things that aren't pathogens. So antigens, surface proteins, they're the things that are capable of generating the immune response. Antibodies are these immunoglobulins that are generated by activated B lymphocytes. So B lymphocyte sitting in the lymph node gets a first exposure to an antigen. They get activated and they produce these targeted arrows, produced antibodies. So if the B and T lymphocytes are hanging out in the lymph nodes, how do they see the antigen? How do they get exposed to the antigen? So A, is the antigen brought to them by special cells or through lymphatic fluid going into the lymph nodes? The answer is the antigen is brought to them by special cells. And these special cells are dendritic cells. So a dendrite is just a term used to describe projections. So a dendritic cell has all these projections on them. The dendritic cell eats the antigen and then carries it to the lymph node where it presents it to the B and T lymphocytes and then gets them activated. Your dendritic cells are everywhere. I call them the alarm cell. So they are found in the skin, the mucus lining of your nose, lungs, skin, omentum, which is that apron structure that covers your intestines. And they're also in an immature state in the blood. So they're ready to find any invading pathogen to get your secondary response going. So just putting this all together, the cells of the immune system look like this, kind of a Venn diagram with only two circles. So these first responders are in the red circle, and the second responders are in the green, and they overlap with those activated B and T lymphocytes. So as soon as you've had that first exposure or you've had a vaccination, you're ready to fight the infection very quickly before there's much destruction of host tissue. So this is why having a vaccine for something like COVID generates these cells. So as soon as you get the infection, these cells kill off the virus before your neutrophils, for example, produce all these cytokines and create havoc in the lungs with the cytokine storm. So which one of these first responders uses the targeted versus the grenade approach to killing the antigen? This is your review question. Is it a basophil, eosinophil, monocytes, or killer T cells? The answer is the killer T. Okay, so these guys are the targeted approach. So activated lymphocytes target the antigen directly. Activated B lymphocytes do it through arrows, through their antibodies, where killer T cells are doing their work hand-to-hand combat. So which cells would you rather lose? Your B cells or your T cells? And this is a poll question because obviously I wouldn't want to lose either one. And let me tell you what happens with the situation where you lose one or the other. So these are the contagious diseases where the viruses actually attack the B or the T lymphocytes. So this is a medical scenario. Your roommate has severe fatigue, swollen lymph nodes. She is diagnosed with mononucleosis. Which white blood cell is being attacked by the Epstein-Barr virus? The Epstein-Barr virus is what causes mononucleosis. Is it her neutrophils, basophils, or B lymphocytes? The answer is the B lymphocytes. So mono is that kissing disease, extremely infectious. Sadly, it remains in these B cells for the whole life of the B cells, and they live for weeks to months. These B cells, these are the inactivated B cells. So they get this intermittent shedding of their virus through saliva. That's why it's called this kissing disease. And they can also work their way into these swollen spleens. So you have to be very careful to make sure you don't have a car accident, anything that could rupture the spleen. So a lot of the follow-up on patients with mononucleosis will be checking to see if they can feel the spleen. Okay, let's go to HIV/AIDS. HIV is human immunodeficiency virus, and it takes over the DNA of the T cell and starts replicating. So it's attacking T cells. So people initially, when they get an infection with HIV, might kind of feel fluish, feel kind of bad. And that initial state kind of wears off. And then these DNA are continually replicated and eventually take over all the T cells. And it's this further replication of untreated initial infection by HIV that creates the syndrome of AIDS, which is acquired immunodeficiency syndrome. So if someone develops AIDS, that's beyond the infection of the virus, where the AIDS is where you've lost your immune function of your T cells. Then these people present with unusual tumors and infections, and very unusual fungal infections. So that's the state of AIDS. So the treatment with a person who has documented HIV infection are these antiretroviral medications that are taken for life if it's documented HIV infection. For people that have had exposure to blood, as soon as they have the exposure, as soon as they believe they've had an exposure to someone with HIV through blood or through bloody needles, they go on this same medications for 6 weeks to try to kill off the virus before it has a chance to attack the T cells. And then they get tested after 3 months. And again, they get tested after 6 months before they're considered free of having HIV. So within the PDF, that's the link that's included in the YouTube video, the explanation of the YouTube video. There's within that file, that link file is the bloody needle story about an HIV stick that I had from a patient in Uganda, and about what it's like to be treated, preventive treatments as PEP or post-exposure prophylaxis, and the complications that can potentially happen from these medications. Now let's go on to the next topic. So a medical scenario, you're diagnosed with gonorrhea. The treatment is high-dose penicillin. The doctor asks you if you're allergic to penicillin. You haven't taken it before, but you have a lot of people in your family who are allergic to penicillin. This is a really common scenario. So what should be your response? Are you allergic to penicillin or not? Should you say, no, I'm not allergic to penicillin, or yes, I'm likely to be allergic to penicillin because all my family members are allergic? The answer is no, because you can't be allergic to something your immune system has never seen before. So this is not a genetic situation. Okay, the GI tract is lined with dendritic cells. So you're taking the penicillin orally. So the dendritic cells, you can't be allergic to something that they have never seen before. And some people develop an allergy from these dendritic cells eating the penicillin, but a lot of times not. Some of the medications that are highly allergic that dendritic cells love to eat are things like sulfa. Sulfa is a super common allergy for people. It really sets off the dendritic cells. Luckily, most people are not that highly allergic to antibiotics. All right, let's talk about a spleen. This is an image I took with a little boy who fell from a tree, and he presented with a very rapid heart rate. The term is tachycardic. His blood pressure was low. The term is hypotensive. And on ultrasound, he had a fractured spleen. So he had emergency surgery, and there's a surgeon holding the spleen in his left hand. So in the operating room, he had a removal of his spleen, and he had to be transfused blood. Quite a bit, actually, 400 cc's of type O whole blood, which is the universal donor. And this is his spleen. So notice that the capsule is fractured. Lots of blood loss with that. Just want to show you just a couple images. This is actually me doing a block, a nerve block, ultrasound guided transverse abdominis plane block. And these are showing the nerves, how they come between these fascial layers, this fascial plane. And so if you inject the medication within that fascial plane, it can numb up the nerves, so that it helps tremendously for pain control postoperatively. It's a segue. Okay, back to the topic. Which immune cells will suffer without a spleen? Is it the T cells or the B cells? And I haven't told you this yet, but we will. The answer is your B cells won't mature. So if you look at this image of the immune system, you have the thymus and the spleen that is included as part of your immune system. The B and T cells are made in the bone marrow from the stem cells, but they get matured in the thymus and spleen. The T cells are easy to remember because T and thymus, T cells get matured in the thymus, B cells get matured in the spleen. And then after maturity, they hang out in the lymph nodes waiting for the dendritic cells to come give them information. So B lymphocytes are matured in the spleen. So without a spleen, the B lymphocytes don't mature. They are unable to make antibodies, but luckily you still have functioning T cells, so that helps with other infections, not all infections. The problem and the clinical significance of this is that people that lose their spleen are more prone to, are more susceptible to getting staph pneumococcal pneumonia, H influenza, because they're encapsulated with bacteria. So they're recommending vaccinations to activate the T cells early for these conditions. Unfortunately, in low resource settings, these vaccines are not available. And so the little boy, unfortunately, would have a tougher time if he got exposed to staph or strep pneumonia and H influenza. So let's go back to the splenic fracture. Why did this little boy lose so much blood? Is it the spleen stores red blood cells, or the spleen inspects red blood cells? The answer is both. The red pulp And the spleen is doing both. It's storing red blood cells and it's having all the red blood cells come through the spleen for inspection. So it's got two major functions, the red pulp, inspecting them, because remember these red blood cells, because they've lost all their organelles, they lose flexibility after 120 days and they have to be culled out of the system. So within the spleen, they get tested for flexibility. And that's why I'm showing this barrel where the red blood cells have to be flexible enough to make it between these barrel notches. And if they can't, then the macrophages come through and eat them. The other thing, and this is the Rubbermaid container, is an extra storage. So if you do have a traumatic event, your body has ready access to red blood cells, like self or auto transfusion. So the white part, the white pulp of the spleen that's shown here by the white arrow, I remember that, the white pulp, because it has the boot camp for white blood cells, the B lymphocytes. So that's the area where these B lymphocytes are being matured. So next topic, let's go on to vaccinations. This is the way I felt after I had my vaccine and I could finally go out and see my brand new granddaughter. What is the first cell needed for an effective antibody response? Is it the B lymphocyte, the T lymphocyte, or the dendritic cell? Answer, dendritic cell. Short-term memory check there. So all vaccines depend on having a robust dendritic cell. And this is just a depiction of all the different types of COVID vaccines. The newest generations of vaccines are these RNA. So those are with the Pfizer and the Moderna. Those are pretty exciting. And the reason that the vaccines came out so early is because of this new technology, which is fantastic. This is why people that get vaccinated with Pfizer or Moderna have a lot less risk of having a reaction to the vaccine itself, because all that's being injected are these genetic codes that go into the dendritic cell. So they're not carrying actual proteins, and these actual proteins and the carrier fluid that people might have a bad reaction to a vaccine. So these are the other types of vaccines. With a viral RNA piece with Moderna or Pfizer, remember the dendritic cells actually eat the RNA pieces, and then the dendritic cells develop these spike proteins because they've got the RNA from the vaccine. And then they go back to the lymph nodes, and those spike proteins generate the immune response for T cell and B cell activation. Highly effective. So if a person gets infected with the COVID virus, they have this massive target approach by their B and T cells. So very effective vaccination. So just to go through a few more slides, I'm going to summarize it and ask a couple more questions, see if you have the short-term memory for these concepts. Your white blood cells, the Venn diagram, the difference between antigens and antibodies, and these targeted cells, lymphocytes. So this is your cast of characters, your dendritic cells, these little guys over here with these arms all around them. the first responders that includes the activated lymphocytes, and these late responders or revenge cells ready to mount an immune response. So this is another couple questions. What about this situation? This is the Ebola virus. It is incredibly deadly within just a few days. Ebola virus avoids detection, rapidly multiplies in the blood, and it causes such a overwhelming infection within the bloodstream, kills off all the organs. So the host ends up dying before any antibodies can be produced. So guess which immune cell fell down on the job? The answer is a dendritic cell. So the Ebola virus evades the dendritic cells. Remember, the dendritic cells eat the antigen, they go to the lymph node and show the lymphocytes what the enemy looks like. So B and T cells are these memory cells for targeted attacks. Okay, let's do another one, medical scenario. You catch the flu, your roommate takes care of you while you are sick. Then 4 days later, you're feeling better, but your roommate is now getting sick with the same flu symptoms. What should you do? Should you stay away from your roommate so you don't catch it back? Or help out if you can, because you won't get it again? And hopefully you've got a robust immune system. Your B and T cells won't let you catch the same virus again. And that's the end of that story.